I think every country in the world is taking stock after COVID. Because you must remember, for the last 2 years plus, health systems have not been functioning at a level they had been functioning at pre-pandemic activity. And I think the time is right now that we're coming out of pandemic, that we start looking at what impact has it really had on our health and social care services. All emergency care, of course, we have responded, and I think our staff have done a wonderful job in the last 2 years, saving lives, looking after people, looking after families. But what I think every health system will tell you, we've had to slow down with the routine operations, the routine outpatients appointments, because we had to redirect our resources. So I think the time is right now here in Gibraltar that we do a stock take of where we are. But more importantly, what I want to find out as the DG, how do we move forward?
And as you say, this review is coming after a time when we're emerging from COVID. But no doubt before this review, you must have a picture of where we were at. What picture do you have at the moment?
I think when I look back where you were at, you were in a relatively good place. Yes, there was some areas where there was long waiting lists, and that's no different from any countries. And one of the areas everyone will raise concern about, even in the UK, in America where I work, and everywhere I work, is orthopedics. Because, you know, a lot of people need some orthopedic treatment at a time of their lives, especially if you have an elderly population. So what I want to do now is just refresh, rethink, but also more importantly, I mean, over the last 2.5 years, people have started to look in a different way of how to receive care and treatment. So I'm very keen, as part of our new program, is to look at how we're going to manage people in the community who need health provision. Is it best to come to a hospital? Is it best we do it in primary care? Is it best we work in partnership with other organisations? So let's move away from the traditional way of thinking and come up with new ways of working. The most important thing to me is that people of Gibraltar don't have to wait longer than they have to, and they're seen as quickly as possible. However, I have to give you a health warning. This will not happen overnight. You know, this will be over a period of time. But I think if we do a stock take now, we can plan ahead, we can be open and honest and transparent with the public and let them know what's happening to their services, and they know what our waiting times are.
So you're talking about perhaps rediverting patients or people needing healthcare to other services, primary rather than the hospital. You're also talking about introducing technology to alleviate or to speed up those waiting times. There have been attempts to introduce technology in some form for the management of waiting times, such as the primary care centre. Still a big issue. People are still having trouble phoning in. On many occasions, they get a message diverting them to the website, to the MyGHA. That website is down most of the time. It's actually down this morning. You got error 404. And then people are unable to follow up because there's no one they can talk to. And those people, they're still waiting. And we don't know about them because they've not been listed anywhere as waiting.
Well, that's why recently I sent out a press release apologising to the public, because I would agree our communication systems here, our phone systems, is out of date. But the good news is we're replacing it, and that work has actually started. So I'm hoping with the next couple of months we will have a more up-to-date phone system. So people, when you ring in, because we get something like in primary care alone, almost 30,000 calls a month. I mean, it's amazing. And that's because people only have one way of contacting us, by phone. What I want to do is start looking at how can we use our website, how can we get people to book their appointments online, how can we get people to be able to get their repeat prescriptions rather than coming to the PCC, that we can get them sent to their pharmacy for them. How can we get our blood results sent out in a text so that people are seeing technology as something which you use on a day-to-day basis rather than something just for the people who are into technology, so to speak. So we're changing the whole landscape here as part of our program. So I'm certainly hoping not just the review of the waiting times we're doing, but the review of all of our services. If we bring it together, the people of Gibraltar will see a far better service. And I'm looking forward, I'm setting up some community forums where I'm going to be out in the community on a regular basis, be it in the evening, to catch people who work, be it at lunchtime or in the morning, so that real people can come and talk to me, but not only come with some of the problems, come with some of the solutions. because that's what I want to do, listen to the public and come back and say sometimes, you know what, if we change it that way, the public would get a better service. This is about us working together.
You mentioned a few interesting points there. One of them, digital technology to alleviate those waiting times, to help with the management of waiting times. The digital divide, a reality, the elderly, not familiar with the digital. There are many entities which are moving mostly digital, leaving a problem for the elderly. Are you going to bear that in mind as well?
I think you have to. I think it's got to be a mix and match. The younger generation, when we look now, and from the research we've been doing in the last couple of weeks, just finding out people's a kind of how to use technology currently, you find the young people, they just jump on their computer, they do everything. My own daughter back in London, her GP service is online. She doesn't go and see one. She has a virtual consultation whenever she wants to have it. She thinks it's brilliant. At the other end of the spectrum, you'd have some older people who say, well, do you know what? I want to see my doctor. I'm not comfortable just going online. I haven't got the skills or competencies. There will be opportunities. This isn't about one way fixes everything. We will have a number of ways of doing it.
And you say you're going to be talking to your clinicians, to your management team.
Absolutely.
You also say you're going to be talking to the public.
Absolutely.
How can the public help in this exercise?
Well, when we announce the venues where I'll be going out to see, what I'd like people to come and have a sensible conversation with me. I've been doing this for years in other countries, and I know it works. And it's not about just coming and saying to me everything that's going wrong. We know there's things wrong. We're trying to fix it. I want people to come and say, but if you did it this way, it might respond better to us as a community. Because I think when you have communities who work together with the system, the health system, you learn from each other. And I'm a very honest guy where I'd be able to say, do you know what, I'd love to do that, but I can't do it. But also I'm the type of guy who says, do you know what, that's a wonderful idea. Let me go back and talk to my clinicians. For example, I'm starting to look now at having mobile health teams out in the community. Basically, why does everyone have to come down to the PCC to have their blood pressure checked, to see their diabetic nurse specialist, etc.? Our teams need to be going out into residential care homes. We need to be going out and working with the pharmacists. We need to be working in community or church centres that you have here. So if you're an elderly person living someplace away from the PCC here, you can pop in because you know someone's going to be there to give you advice. So this is about radical change where we want to bring in. It's going to take time, but we've started.
Big change, use the word radical there. You are a professional who's been brought in with a purpose. You've got a strategy. You say there's no quick fix. What's a realistic timeline? You must have one in your head.
What we're saying is we're working out a time frame. For instance, if you look at the primary care reviews, we started that process. So within the next 2 to 3 months, you're going to see some differences. With the review of the waiting times, we started a process. So we should be coming out with some idea of some of the key milestones we need to address in the next couple of months. So what I want to do with the board, and I need to take it back to our board of directors as well, is I want to work out a kind of a milestone pathway. So we'll be able to go public, share with the people, because we can't do everything together. But there's quick wins for the public we have to do. Like you said, when I ring up PCC, I want someone to answer the phone. I don't want to be number 20. I get to number 3 and it's cut off. I want someone to answer the phone. I don't want to be queuing outside the PCC building to get in for my appointment. So there's certain things we can do quickly, and I'll be keeping the public informed about that once we complete our time frame and I have it signed off by our board, which meets at the end of the month.
And radical changes, introduction of possible mobile patrols, reviewing the entire system, technology, it costs money. Will this mean the GHA can work with the current allocated budget?
I think before we talk about asking for more resources, we need to look at what we're doing with the current resources. And there are resources in the system which I think we could use better. And that's not being critical of people who are working here. I think we need to actually look at how we spend our money. Do we spend it wisely? But also, are we investing our money in the right place to get the right outcome? That's going to be a challenge. But at this moment in time, we're reinventing a lot of the resources we have. And that will be my approach. I've had very interesting and very supportive discussions with government, with the Chief Minister, and they're willing for me to approach them if I feel there needs to be an investment. But I'm the type of person, before I ask, I make sure I do my homework and make sure that actually I'm spending your money wisely.